Hello, my name is Dr. Lena Edwards, and I am a board-certified integrative medicine specialist and a stress medicine expert. It is with great passion for women and their health that I would like to discuss with you the topic of stress and how it differentially affects women. My goal in providing you with this complimentary webinar is to educate and empower you so that you can proactively take all the steps necessary to get and stay healthy, especially if you have chronic stress in your life. No matter how much we try and avoid it, stress is all around us. It's at our jobs, it's in our homes, it's in our relationships, and it affects the way we eat, sleep, work, think, and live our lives. In addition to these common stressors, though, there are a number of other stressors in our environment that also affect the way that our bodies respond to stress, and so ultimately affect our overall health. These include such things as environmental pollution, the use of toxic substances like alcohol, nicotine, and other drugs, prescription drugs, environmental toxins, and what we eat. These are just a few of the other things in our environment that our bodies consider stressful when we are exposed to them in one form or another. To add even more complexity to this already complex story, there are even factors outside of your control which can affect how your body responds to chronic stress. For instance, age. Your age will determine how well your body is able to tolerate stress and for how long. Genetics. Some of us are more vulnerable to the effects of stress simply because of our hereditary background. Things such as childhood exposures to stress, especially if they happened early in childhood or even into adolescence, can permanently compromise how well our bodies can withstand the effects of stress. So can our coping style and our personality type, and even the type of stress which we are exposed to can affect how our bodies respond to stress and for how long our bodies can respond to stress before damaging effects occur. However, perhaps the most impactful of all of the factors that control our stress response but are not necessarily in our control is our gender. And the fact that we are female plays an incredibly important role in how our bodies hold up to the negative effects of chronic stress. And that's what we're going to discuss for the remainder of this webinar. So why is chronic stress so dangerous? The truth be told, some amount of stress is good and even necessary for our health and well-being. However, it is when the stress becomes excessive or prolonged or severe that we start to experience the negative health effects. This primarily occurs because of one primary hormone, and that hormone is called cortisol. And I'm sure that many of you have heard about cortisol and the adverse health effects of chronically elevated cortisol levels. But it's important to remember that cortisol is our primary fight or flight hormone, and it is critical for our survival when we are faced with an acute stress. Cortisol is the hormone that's responsible for making sure that our bodies have the energy and the fuel we need to fight off the stress that we are trying to encounter or to flee from it to protect ourselves. It is only when cortisol levels remain elevated for a prolonged period of time that this very hormone designed to protect us becomes our greatest enemy. Over time, it can create problems with our bowels, our digestion, our bowel movements. It can cause us to become more sensitive to foods, to grow bacterial organisms in our intestines that shouldn't be there. It promotes the formation of belly fat, and many of us have experienced this problem. It can create all kinds of mood problems from anxiety to depression to ADHD, and can compromise our sleep, which can make our mood issues even worse. Our immune systems are also not immune, no pun intended there, to the effects of chronic stress and the chronic levels of cortisol elevation that occur as a consequence thereof. And in women, one of the major systems that's affected by chronic stress is our female hormones, and chronic stress and high cortisol levels wreak havoc on our female sex hormones. This can manifest as a variety of different issues, which we'll be discussing in here in just a moment. But let me explain to you what happens under normal circumstances first. Normally, there are two important glands in our brain. One is called the hypothalamus and the other is called the pituitary gland. And these two centers in our brain produce hormones which tell our ovaries to produce estrogen, testosterone, and progesterone. This system from the brain to the ovary is responsible for everything from our menstrual status to our ability to have children. Prolonged levels of high cortisol as a consequence of chronic stress or other factors which we've already discussed can prevent the proper production of these very important female sex hormones at multiple levels of this system. So cortisol can suppress the hypothalamus, it can suppress the pituitary gland, and it can also directly suppress the ovaries, which will then negatively affect the production of progesterone, estrogen, and testosterone. This in turn can result in such things as irregular periods, lack of periods, premature menopause, infertility. In fact, 1/3 of all cases of female infertility can be attributed to the effects of chronic stress. Yet most conventionally trained medical doctors are never trained to look for problems within the stress response system. PMS can also occur. But the interesting thing about hormones and hormone relationships is that female sex hormones can also affect cortisol levels. I am not sure if you knew that or not, but let me say that again. Your sex hormones also directly affect your cortisol levels and therefore will determine what type of stress response you can manifest and how long your body can take the stress before you start to develop problems. By affecting cortisol levels, either positively, as in the case of estrogen, or negatively, in the case of progesterone and testosterone, the levels of estrogen, progesterone, and testosterone can have a direct impact on your body's ability to produce cortisol, and therefore your ability to withstand stress. It's also directly affected by your menstrual status and other factors which control your sex hormone levels. So, for example, if you are a woman who suffers from polycystic ovarian disease, endometriosis, PMS, and other types of female hormone disturbances, you tend to have higher estrogen levels overall and lower progesterone levels, usually either because you're not ovulating or you may be ovulating and not making enough progesterone to balance all the estrogen that you make. Because estrogen raises cortisol levels, these situations can create chronically elevated cortisol levels. However, keep in mind that this can also be influenced by body weight, nutritional intake, levels of exercise, and other factors. Women who are having regular periods, normal periods, tend to have lower cortisol levels the second half of their cycle if they are ovulating normally and producing progesterone. This is because progesterone tends to lower cortisol levels. So even within your normal menstrual cycle, your cortisol levels can vary, and therefore your stress tolerance and your ability to mount a stress response can vary throughout the month. The sex hormone levels in women in perimenopause are constantly fluctuating, which means their cortisol levels will fluctuate as well. And again, that translates into differential abilities to tolerate stress and to mount a proper stress response. And once you're in menopause, women who have reached menopause have been shown to experience consistently low cortisol levels. It is believed that this is primarily because of a drop in their estrogen levels. And while many people think that high cortisol levels are the primary problem, low cortisol levels can cause just as much trouble. And symptoms can include things such as weight gain, depression, chronic fatigue syndrome, fibromyalgia, many mood disorders, and several other symptoms. So regardless, your female hormones and whether or not you have a female hormone disturbance, or you are menstruating and it depends on the time of your cycle, or even if you're in menopause. These situations will then determine whether or not you have high or low cortisol, and then you'll have other symptoms related to your cortisol levels on top of these existing symptoms. So in light of these facts and the way female stress hormones and sex hormones affect each other, women have been shown scientifically to experience more exposure to stress, more sensitivity to the effects of stress, more vulnerable to the negative effects of stress, more stress-related bodily symptoms such as fibromyalgia, chronic fatigue syndrome, and mood disorders. Women tend to have higher baseline cortisol levels and higher cortisol levels in response to stress. And again, there are several factors that we can attribute to this too. However, the primary reason that women compared to men have more sensitivity and more issues with respect to stress is because of the relationships which we've discussed between the female sex hormones and the female stress response system. So what can you do then? While this information may seem daunting, there is good news. And the good news is that you now have the knowledge to do something about your hormonal disadvantage so that you don't have to take a back seat and suffer needlessly simply because you happen to be female. So obviously, there are some very important things that you can and should be doing. And these things include getting enough sleep, eating a healthy diet, engaging in regular, moderate exercise, reduce your exposure to environmental toxins as much as you possibly can, do your best to maintain a healthy weight, which of course may be a challenge if you're struggling with sex hormone and stress hormone imbalances, do your best to avoid alcohol, nicotine, and other drugs, and practice stress reduction techniques, whether that's cognitive behavioral therapy, yoga, tai chi, prayer, meditation. That can take many different forms. So these things are foundational, not only to help your body withstand the negative effects of stress, but also to maintain your health, well-being, and longevity. However, even with these important steps, many of my female patients have still had issues simply because the other factors that we've discussed, those that you cannot control, specifically the fact that you're female, make it very difficult sometimes for these measures alone to be completely helpful. So it's important for you to understand that there are also scientifically proven natural ways to help you balance your female sex and stress hormone levels, especially if you have chronic stress in your life or if you are suffering from one of the other female medical hormonal conditions which we discussed earlier. After years of painstaking research and my frustration as well as that of my patients at a lack of an ability to improve even with the measures that they initiated, which we've already discussed, I decided to develop an all-natural, scientifically proven nutritional formulation specifically for women. This supplement is called AdrenaFem, and I would like to give you a little bit of information about it because it has been life-changing for the patients that have been using it. As an expert in stress medicine and in female hormone imbalances, I have cared for countless women over the past 20 years who have been challenged by the very issues that we've been discussing. Until now, there was no supplement, no medication, nothing that existed to help these women improve and maintain their stress and sex hormone levels. And it was primarily because the supplements that are available don't take into account these very real gender-specific differences in how women and men respond to stress. So the one-size-fits-all approach was not working for my patients, and I created AdrenaFem as a breakthrough in stress medicine as a way to help women engage and give them a way to empower them and help them with their health in a manner that didn't require prescription drugs or ongoing frustration with a lack of benefit from the things that they were already doing. So I would like to just briefly discuss with you the ingredients that I chose to put into the formulation AdrenaFem to give you a better understanding of why it is different from all of the other one-size-fits-all stress supplements. This vitamin formulation contains several different vitamins, including vitamin C, B5, B6, MTHF, and magnesium. Vitamin C has specifically been shown to improve stress tolerance, and it reduces the amount of cortisol that's produced in response to stress, something that women notoriously have a higher level of issue with than men do. Vitamin B5 helps to favorably modulate adrenal gland cortisol production, especially in women who tend to have low cortisol levels. Vitamin B6 prevents adrenal gland damage, and it helps cortisol work better when it is around so that excessive amounts are not produced. L5-MTHF is the activated form of folic acid. This is particularly important in women of childbearing age. 1/3 of the US population has an inability to actually properly activate folic acid in their diet, and so can develop mood problems, cardiovascular disease, blood clotting disorders, and other problems. And it's for this reason that we've taken the proactive step of including this very important nutritional supplement in this formulation. Magnesium has multiple health benefits as an important cofactor in over 300 different bodily functions. Women tend to be notoriously deficient in magnesium, and magnesium also mediates the stress response. Another ingredient is called diindolyl methane, which many of you may know as DIM in short. DIM has been shown to promote favorable estrogen metabolism, and it's also been shown to reduce the risk of ovarian and breast cancer, as well as to reduce the symptoms of endometriosis and other conditions which are flourishing under conditions of estrogen dominance. Black cohosh has been shown to improve symptoms of PMS, perimenopause, menopause, and painful cycles. It's also very important in reducing anxiety, improving sleep, and improving bone health. One of the ways in which black cohosh actually works is that it is a phytoestrogen, and it also helps to inhibit serotonin reuptake. And so in many cases is even more effective than some of the prescription drugs which many conventional doctors try to offer their patients. And then diosgenin, which is an antioxidant, anti-inflammatory, and an anti-cancer agent. Because it contains natural bioidentical estrogen, it helps to balance out women who suffer from estrogen dominance. It's also been shown to help prevent breast and endometrial cancer. This formulation also contains several herbs, which are known as adaptogens. Adaptogens have been used in Ayurvedic and Chinese medicine for over 2,000 years. So clearly they have a long-standing history of being very safe and very effective. And there are many, many scientific studies that have been done with a variety of different plant adaptogens. While adaptogens in general have been shown to help the body withstand the negative effects of stress, DNA damage, and cell death, several of these adaptogenic herbs have unique properties that are especially beneficial to women. One of them is ashwagandha. And ashwagandha has all of the benefits of other adaptogens, plus it has been shown to improve sexual function, it has been shown to reduce breast cancer, and it's also been shown to be improving thyroid hormone function and conversion. Cordyceps is another adaptogenic herb, which has been shown to improve exercise tolerance and performance, mental function, sexual function, immune system function, and energy. It's also a natural antiviral and antibacterial and anti-yeast. So again, another very important ingredient in this formulation. Ginkgo is another member of the adaptogenic herb family, So in addition to all of the other health benefits adaptogens offer, ginkgo in particular helps to improve the symptoms of PMS, it helps improve sexual function, and it improves symptoms of fibromyalgia, which is notoriously more common in women than it is in men. Rhodiola is another adaptogenic herb which has been shown to enhance stamina, endurance, mental function, immune system function, and it also serves as an anti-anxiety, a natural antidepressant, and a very potent antioxidant. And finally, Siberian ginseng. Again, qualities very similar to those of rhodiola in improving stamina, endurance, mental function, preventing cell death, and improving mood, and even improving sleep. So is AdrenaFem right for you? Well, ideal candidates are those women who may be experiencing female hormone imbalances due to chronic stress, or are having stress-induced menstrual cycle irregularity or infertility. However, if you are a woman who suffers from PMS or polycystic ovarian syndrome or endometriosis, or even if you are an otherwise healthy woman who is perimenopausal or in menopause, this supplement may also be helpful for you because of the many reasons we've already discussed. Some women who are not candidates for hormone replacement in any form, such as those who may have had breast cancer, can also consider using AdrenaFem as a substitute for hormone replacement therapy. And some women can even delay going on hormone replacement therapy with the proper use of this supplement. This supplement, however, is not recommended for use in women who are less than the age of 18 or women who are pregnant. As a side note, if you are already on hormone replacement therapy, you can add AdrenaFem to your current regimen. However, make sure that you are working with a highly experienced, credible, and properly certified physician who can properly adjust your hormones if necessary. If you don't have a physician or you don't feel like things are quite right for you right now, you are more than happy to contact us and I will do a consultation with you. Here are the recommended dosing guidelines for AdrenaFem. Please note that all of the ingredients found in AdrenaFem are safe. They have been around for a very, very long time. There are no major herb-herb or herb-drug interactions. However, women who are taking digoxin, which is a heart medication, or Coumadin, which is a blood thinner, should exercise caution since some of the herbs found in AdrenaFem can interfere with the actions of these medications. The information regarding clients that are candidates for AdrenaFem and also information about dosing can also be found on our website, where you can find information about AdrenaFem and also on the AdrenaFem FAQ pages. So in closing, whether or not you are a young woman who suffers from PMS, endometriosis, heavy periods or painful periods, or if you're a menopausal woman, has no energy, can't sleep, and can't lose weight, AdrenaFem can be an incredibly important addition to your overall health and wellness program. But the only way for you to know is to give it a try. My name is Dr. Lena Edwards, and I hope that you have found this webinar to be informational and motivational. The time has come for us to think differently about how we manage stress in our patients. And while I am actively trying to educate physicians and other healthcare practitioners on the very same information that you just learned, I encourage you to embrace the fact that you are a female and proactively take control of your health. Thank you for your attention.